So today, we are very pleased to have one of our physical therapists. She's also a Ph.D., Valerie Franck, with us. Thank you, Valerie. And again, thank you for being here, and I know we'll learn a lot today.
Thank you. Wonderful introduction. So this is part of a workshop I took through the Academy of Geriatric Physical Therapy in Portland. And so I just wanted to share this information because not all of it is applicable to working in a hospital. So I just want you guys to have access to this, how to keep you out of the hospital, hopefully. So things that can increase your risk of falls, and falls are the #1 cause of injury for people 65 and over. And it's a pretty grisly statistic, but 1 older adult dies from a fall in the United States every 20 minutes. So it's not just injury. Some of these can be catastrophic. Things that can increase your risk, pretty obvious, poor balance. Balance fluctuates. It's not always at our best, and it's not always at our worst. So it can change from day to day. It can change during the day. We can improve it, or we can do things that cause it to kind of worsen over time. And then if you've had a fall, and most of us have fallen, myself included, so I would say more if you've had a fall within the last year, that's when you should worry. Other things, if you're 65 and over, if you have any kind of weakness, mostly in the legs and the core, but it can be weakness anywhere, or you tend to not be that active, and we'll talk about the goals for activity for older adults at the end. If you are on 4 or more medications, something called polypharmacy, or some medications, even if that's the only medication you take, can increase your risk of falls. And I have a slide at the end, so if you want to come ask me what those are, I can show you. The information is on the Centers for Disease Control and Prevention website, so it's easily accessible, and your doctor should probably know what those are as well. I'm not saying don't take them. I'm just saying if you are on one of those medications, or if you are taking 4 or more medications, you are at increased risk, so just be extra careful and work on your balance. If you have vision or hearing problems, and I would especially underline the vision, because that is one of the sensory inputs that goes into balance, and I'll talk about the others. And then any kind of foot problem. You have a deformity, you have pain, your ankle's stiff, your toes are stiff, or you have some kind of wound, or even lack of sensation on your feet. So if you're willing to share the information with everybody, and this is being recorded, feel free to raise your hand if you want to, if one of these apply to you. Okay, and then you can put your hands down. If you're willing to share the information, if 2 or more apply to you. Little hesitation, but yeah, okay. So it's pretty common, yeah? And then why do we care? Really, these stats vary, but only 1 in 10 falls will lead to serious injury. So that's a lot of falls that are happening where people aren't going to their doctor, they're not going to the hospital. So these numbers are probably underreported. And so you have some wiggle room there, but that 1 in 10 can be life-changing. The big one is brain injury. So let me get my stats right. Oh, it's over here. 50% of traumatic brain injury in older adults are from falls, which surprising to me is kind of low. I would have thought it would be higher, but 50%. And almost all of them, if it's a serious brain injury, you're going to end up in the hospital. So that's, that's a commitment to going in the hospital. Broken hips, almost 90% of the visits to the hospital from a broken hip are from falls. Most of those are in women, but it does happen to men. you can die from a broken hip, and you can die from a brain injury. So those are the two biggies. You can also fracture ribs, break your wrist, or break your shoulder. This can make getting around really difficult. If any of you have broken ribs and tried to get in and out of bed, you know how hard that is. Even breathing. And then for those of you that have broken a wrist or a shoulder, imagine living without the ability to put weight on your arm for a couple weeks or months. Just getting dressed is hard. And if you use a walker, really hard to walk. And then it can lead to fear of falling, which can be debilitating. So I'm not talking about concern over falls. I'm talking about a fear of falling. So you're limiting your activity, you're behaving in ways that can increase your risk of falls, you're tensing up, closing your eyes, grabbing onto things, making really kind of drastic reactions to small changes in balance. And that is something that is really hard to work on, but you can work on it. And then all of these can lead, if you do live at home, if you do your own things, you cook for yourself, you're going outside, driving your car, taking the bus, some of these injuries might take that away from you for months, years, or forever. And that's what we really want to prevent. So this talk, I'm going to go over general information about balance. It's going to be kind of nerdy. You can tune it out if you're not interested in that. And then what physical therapy can offer, and then what you can do outside of physical therapy, because not everyone wants to come to the office, and I'm talking about outpatient physical therapy, once or 3 times a week. It's expensive, it's time-consuming, you have to have transportation. Not everyone wants to do that. We have a lot to offer, but there are things you can do outside of physical therapy. So information on balance. There's 3 main sensory systems that contribute to your balance. And these go into the brain, they're integrated very, very quickly, and then they're used to make posture adjustments or decisions that can keep you from falling. And the big one is vision. For very small children and older adults, that's the main source of input for balance. So if you have vision problems, you can see it can be pretty difficult to react quickly. The second one is what we call proprioception. It's a special kind of touch. So there are stretch and pressure sensors in my muscles, my skin, and my joints. And they tell me where my body is in space with my eyes closed. And the ones in your feet, your ankles, your knees, and your hips, and your spine are very important for balance. Because you're looking at something else, you're looking down at your phone, you're talking to somebody, something disrupts your balance, and you can fix it automatically without having to say, oh wait, what's going on? Where are my feet? Where are my knees? Where are my hips? There are certain problems that can disrupt this. Or if you've had surgery to the knee or the hip, or you have foot pain, that's when this becomes more difficult. The use of proprioception. It can be trained up. You can go to physical therapy, work on your proprioception, it can get better. And then the last one is your inner ear, vestibular input. And that tells your brain where your head is in relation to your body. So turning right and left, up and down, even moving in an elevator without head turns, going straight up and down, or moving in a car, going forward and backward. You know that even with your eyes closed. But there are things that can affect the vestibular system, and it kind of downregulates. It gets slower as we get older. So this sensory input, I have a cat toy as my laser pointer. The sensory input goes into the brain, the spinal cord. It gets integrated very quickly. Sometimes it doesn't even go to the brain. It just goes to the spinal cord. And then it kind of comes back out as instructions to your body about what to do to prevent a fall, to adjust your posture. So there's a lot going on. And I always like this picture or pictures like this because these are automatic movements that we make when we lose our balance that we don't think about. And there are problems with the brain that can prevent these from happening quick enough. So instead of putting our arms out, we hit our head. And you can train these. I know they're automatic, but you can practice them. Do not do this on your own. But this is something a good physical therapist can do for you. And they can become a little bit more automatic, or you can learn to work with a slower response. Okay, so what can physical therapy do? The first thing we can do is give you an idea of your risk. You may not be at increased risk for falls. Everyone 65 and over is automatically at 25% risk for a fall within the year. That's gone down from 30%, so that's good. But there are certain people in here that are probably lower than that, and maybe some people that are higher than that. So we can actually look at your performance, or even you can take a simple questionnaire, and we can give you a yes or no at you are higher risk or lower risk. This comes from the Centers for Disease Control and Prevention. It's called STEADY. It's a program designed to prevent falls. And the 3 performance-based tests. Did anyone come to our 125th anniversary? We did one of these tests. They're not easy tests for most people, but you kind of want to do all 3 to get a good picture. The 30-second sit to stand is leg strength. So you're sitting in a chair, you're standing up all the way, sitting down all the way, as many times as you can in 30 seconds without using your arms. Your arms are across your chest. There are normal values for your age and whether you're a man or a woman. If you're at those normal values or you're higher, meaning you're doing more squats, essentially, you're good. If you're lower than that normal value, you're probably at higher risk for falls, higher than that 25 to 30%. So that means we need to work on your leg strength. The second one is a standing balance. It's real quick. I do it with some of my patients at the hospital. Please don't do this on your own if you think you're at risk for falls. Have someone next to you. The first one is very simple. Your feet are together, toes and heels touching. If you can't do that, get as close as you can. Hands on hips. You're here for 10 seconds. The next one, you move 1 foot forward, doesn't matter which foot, slightly. Feet are still touching. 1 foot is in front of the other. Hands on hips, eyes open, 10 seconds. The next one, your heel is touching your toe. So you're standing in a straight line. You're not staggered. They are touching. Hands on hips, 10 seconds. That's the cutoff. If you can't do 10 seconds, higher risk of falls. This is something you can practice as a balance exercise. If it's too easy, you can close your eyes and move your head. I don't want to fall on stage, so I'm not going to do it. The last one is you're going to balance on one leg, hands on hips. The free leg is not touching. It's floating. Hands on hips. It's much easier if your arms are out here. So hands on hips, eyes open. Can you do this 10 seconds? Doesn't matter which leg. That's the one most people struggle with. I used to never do it in clinic because it depressed people. And I don't want to make them feel bad about themselves. But it is important for getting your underwear on. If you don't sit down, it's important for stepping on and off of a curb. It's important for stairs. So it is a key measure that I do measure now. The tug, you're sitting in a chair. The chair can have armrests, so you can use your arms. You can use a walker or a cane if you need to. You're going to get up from the chair. You're going to walk 10 feet, turn around a cone, come back down and sit down, and someone is going to time you. If that is less than 12 seconds, you're good. 12 seconds or longer, increased risk of falls. So you can see we're looking at leg strength, balance, and walking, the 3 big components that a physical therapist would work on to decrease your fall risk. If you don't want to do any of that, you can take a questionnaire. There's 12 questions. They're yes, no. If you add up the points and you get a 4 or more, I believe, the information is on the bottom. It's the Stay Independent brochure. Then you are at increased risk of falls. This is something you can take to your doctor, say, I want to work on this, give me a referral to physical therapy. And then some of these you can modify, some you can't. If you are rushing to the bathroom, maybe physical therapy can help that, pelvic floor physical therapy. Maybe not. That just might be an effective medication and something that you're going to have to change your behavior about, because that is a fall risk. If you want an actual percentage, you like to work with numbers. This is a kind of an old paper, but it will give you an actual risk of falling within the year for you. And you start with 30%, because that used to be the number. And then you adjust that. If you have depression, and there's a depression screen you can take, it's just a few questions. If you're afraid of falling, that's a questionnaire you can go through. I think there's 24 questions. If your tug score, that one where you're sitting in the chair and you're getting up and you're walking 10 feet and you're turning around and you're sitting down, if that's 12 seconds or more, you can get an actual percent risk of falling within the next year. These are just estimates. And then the sit to stand test also. The two that I would focus on would be your ability to balance on one leg with your eyes open, or how fast you walk. This is a weird one because in Hawaii it's hot. So some people walk slowly so they don't sweat. That's fine. It's also a cultural thing. If you've ever been to New York City, watch out. You're gonna get run over if you don't walk fast. So again, you can measure it a couple different ways. You can measure it the way you normally walk. You can measure it the way you walk when you're trying to cross the street so you don't get hit by a car. Or you can measure it kind of your speed walking or your fast fitness walk. But it's an actual number. And it says a lot about your health, so there's more than one reason to measure it. So just as an example, I know this is a lot of numbers, but their cutoff for balancing on one leg is 6.5 seconds. Who measures half seconds? Not me, but anyway. Let's say you can't balance on one leg for more than 7 seconds. Or sorry, I should say 6 seconds, more than 6 seconds. Your fall risk for the year, 45%. That's why I mentioned that test. That's why I do that test now. And this is research-based. It's just correlation, right? This is what we're measuring in people that live in their homes, and we measure it, and then we ask them, we follow up for a year. Did you fall? This is an annoying call to your home phone. Hi, did you fall? Did you fall? Did you fall? And then all those stats go in these research papers. And then if you want to look at the walking speed, this is your ability to walk 20 feet in less than 6 seconds. And you can time yourself. Again, whether you want to do it at your normal walking speed or the speed that you use to cross the street, on Kalihi Street, whatever. If you're able to walk 20 feet in less than 6 seconds, your fall risk drops from 30% to 20%. So that is a good number to measure. It also reflects your 5-year mortality. So it's a good measure of longevity. How fast can you walk? Okay, so you have your idea, am I at higher or lower or average increased risk of falls? Now we can actually look at your balance. What's going on? Why is that risk higher? And at physical therapy, the gold standard is this BEST test. Not a lot of people do it. It takes 30 to 45 minutes. I try to do it now because it incorporates almost everything. And then you find the weak spots and you just work on the weak spots. You're not just giving a ton of exercises that they don't need. But ideally, if you go to physical therapy, you want someone measuring your balance, your strength, specifically your leg strength, and your walking. And not just how fast, but how are you avoiding obstacles? How are you able to speed up and slow down? How are you able to turn while you're walking? How are you able to do math problems in your head while you're walking? Because most of us are walking on our phone, right? We're not paying attention. So that like dual tasking, right? Busy slide, but this is what goes into the BEST test, and this is how physical therapists think of balance. And we call it postural control because we want to sound fancy, right? So the first one is your strength and your ankle mobility. And part of this, can you get up from the floor in 2 minutes or less without help from someone? You can use a chair, and I would recommend that. And there's ways to get up from the floor that your physical therapist can show you. But that's one of those tests. Can you come up on your toes? How strong are your legs? The second one, we call it limits of stability. So how far can you reach outside your base of support? And if you're standing and you look down, your base of support is kind of a circle around your feet. So those of you that like to stand really narrow, right? Your base of support is smaller. So that's why we're always nagging folks at the hospital to put more width between your feet when you walk. And I catch myself doing it as I get older, so I don't know what's going on with that, but it's just like a weird thing that happens as you get older. But how far can I reach outside of that, to the front and to the side, without having to take a step? And then when there's one where you're sitting and your eyes are closed and you reach all the way over and you try not to fall and then you come back up, do you adjust to vertical? Because not everyone does. Some people will come back and this will feel upright to them. You could see how this would be a fall risk if this is what you're trying to come back to when you lose your balance. So that's good information to have. Transitions and anticipatory postural adjustments. When you get on the bus and the bus starts moving and you're still walking, you probably walk different, right? That's anticipatory postural adjustments. If you've ever seen a baby learning how to walk, their arms are out, their feet are wide apart, right? So that's might be how you walk on ice. You're lowering your center of gravity, you're making a wide base of support, your arms are out here, and you're being very careful. So how well are you able to do that when we ask you to shift your weight? So when we ask you to take a step, can you shift that base of support? And then transitions, so taking steps, standing on one leg, changing your body position. Oops, sorry. And then reactive, so we will push you. It feels really mean, I hate doing it, and we don't warn you when we do it. And we'll push you small little push, so we can just see how well you are able to adjust your trunk without having to take a step. And we will ask you to lean into me, and then we'll let go. And we're looking for that one big step. And we'll do it forward, and we'll do it backward, and everyone hates that, and they won't lean. They're like, no, I'm not going to do it. I'm not going to do it. So it may take a couple tries, and then we'll do it to either side. And we're looking for that one big step. What we don't want to see is, right, small little steps that go over and over and over. And again, you can train that, but it's scary, and you want to do it with a physical therapist. And then sensory orientation. We can't really measure your vestibular function, the one where you track your eyes with your head, and you can tell where your head's moving in space. But we can kind of measure it. So we'll give you a general idea of how your vestibular function is working. We'll give you a general idea of how your somatosensory, your proprioception, your ability to tell where you are in space with your eyes closed, a general idea of that. And then we'll also measure your balance with your eyes open. So how good is your vision at helping your balance? And then we'll do a bunch of walking tests, and we'll measure walking speed, and we'll have you walk over an object without trying to slow down, and we'll have you turn really fast and stop, and that kind of stuff. Sometimes people are mean and they make you walk backwards with your eyes closed. So if you don't get your best test done and get an idea of your balance that way, what you should look for from your physical therapist is some measure of your balance. The Berg balance test is a little easier, but you can do it. The dynamic gait index is your balance while walking. And the functional gait assessment is also your balance while walking. A little bit harder. It was designed for people who maybe have inner ear issues. So we're really going to have you walk with your eyes closed. They should also probably measure your walking speed, excuse me, and your walking endurance. So how long can you walk in 6 minutes? Because our balance gets worse as we get more tired. And if you're going shopping, you know, you're not standing up and walking a short distance. You're walking pretty far. Also, taking a shower is tiring, and as you go to step out of the shower, it's wet and slippery. So that's another thing to think about. Okay, so now you have an idea of your balance. Now we're going to give you some exercises. This is the slide for people who want to work on their balance. There is a handout back there of the recommendations for physical activity for older adults. I recommend you take a look at it. If you're not concerned about your balance or you're at low fall risk, that's what you should aim for. If you want to work on your balance, this is what you need to aim for, and it's a little bit more. 52 hours is what the research says to make a meaningful, lasting change. You will see changes pretty quickly. I see changes in my patients within 2 weeks if they do their balance exercises every day. They can go from not being able to balance on one leg for more than 2 seconds to 10 seconds in 2 weeks if they do it every day. However, we want to make sure that that is lasting change. And that's what the research shows, 52-hour commitment. And we're not going to do that in therapy. We don't have that. I wish insurance would pay for that. But I don't think you guys would want to come to the clinic for 52 hours, right? So you do have to do your home exercise program. Yeah. No, just a commitment to 52 hours. You kind of want to get it done in a year because you want to build on strength changes and you want to build on your cardiovascular fitness, but it doesn't need to be done in a month. Usually it's over 6 months, depending. It might be over a year. So you're doing your home exercise program daily. You're not doing strengthening daily. You're doing strengthening 2 to 3 times a week, but you're working on your ankle flexibility. You're working on something every day. You're working on your balance every day. And it really only has to be 1 minute to 3 minutes. It doesn't have to be very long, but make sure that it's safe. Okay? Someone's next to you, there's a wall behind you, there's a chair in front of you that you can hold on to. Here's the bad news. If you want to improve your standing balance, you have to do your balance exercises in standing. And you can't hold on. You have to let go. That's why I want someone next to you. You have to kind of lose your balance. And we have this scale from 0, I have no balance challenge, I'm lying flat on the ground, to 10, I am in the act of falling, okay? You want to kind of be in the 5 to 6 range of comfort. And if that's not acceptable to you, you can work up to that. But you do want to challenge yourself. So some of these classes I'm going to talk about, you can start in sitting, but just know that that is not going to improve your standing balance. Some of the strengthening exercises that you do in sitting might, but not the balance exercises. And then you really see gains with the daily balance. Your brain really has to rewire itself, and that what we know about neuroplasticity is that it has to mean something. That's why you kind of have to lose your balance. You have to feel like, oh, that was a near miss, because then your brain pays attention. And you have to kind of do it enough that your brain actually rewires a little bit. And then this is the big one. All of these classes and programs are working towards you maintaining your fitness on your own. And these are the guidelines for everyone in the United States, whether you're 65 and older or not. 150 minutes of moderate intensity aerobic exercise per week. And you're like, moderate, what does that mean? So the easiest way is, again, on this 10 scale, where 10 is, I can only do this 2 minutes and I'm going to pass out. I cannot talk at all. And one is, I feel no challenge. This is great. I could do this for 24 hours a day. You want to kind of be in the 5 to 6 range. What people also say is you should be able to hold a conversation, multiple sentences in a row, but not sing. You can't sing. I don't sing. I have a terrible voice, so I'm probably not going to use that one. But if those of you are singers, you can test yourself. And if it's hard to sing, then you're probably at that moderate level. If you have a smartwatch or a Fitbit, some of these will automatically track. This is why I love Garmin. I'm not sponsored by Garmin, but Garmin has this intensity minutes thing, and it calculates it per week, and it aims for 150. And if you're in the moderate range, it gives you 1 minute for every minute of activity in the moderate heart rate range. If you're in the vigorous heart rate range, it will double that and give you 2 minutes for every 1 minute of vigorous activity. So those of you that are tennis players, pickleball players, if you're spiking your heart rate occasionally, you're not just staying in the moderate. Those of you that are runners, hikers, this is great because it'll give you your weekly metric. And please, if you're not there yet, don't do it overnight. That's a recipe for injury. Work with somebody, a personal trainer, a physical therapist, on a program. This is your goal, injury-free, because you're doing it every week. So if you're getting tendinitis or your muscles are too sore to do it, it's kind of backfiring. And it can be walking, right? You just want your heart rate, for those of you that use zones, in the 2 to 3 zone. And again, Garmin will tell you your zones, and it will automatically figure out your max heart rate, and it will do all that for you. But if you know your max heart rate, you kind of want to aim for 64 to 75%. I don't know why the American College of Sports Medicine did that, but that's what they want. Okay, how do you work on balance effectively? Notice that there's a physical therapist. She's right there, but she's not touching you. When someone holds on to you, it gives you more confidence. So they really shouldn't be touching you unless they have to. This gentleman is doing something called Clock Yourself. This is an app you can download. It's not free. I apologize. I think it's like $5. I forget. It was developed by a physical therapist, and it works on your phone, and it gives you audio prompts so that you don't have to look at your phone and work on your balance while you're looking at your phone. You can listen to it. But the idea is you have this imaginary clock around you, and you're being told 1, 11, 12, and you're touching those numbers with your foot. And you can start slow. What does this do? This works on single leg stance. It works on reaching outside your base of support. It works on the automatic postural reactions. It works on multiple things at once. And as you get better, it works on your brain because they start to make it more difficult for you. Instead of clock numbers, you can have words in Japanese that you have to memorize and know where they are. You can have colors or symbols that you have to memorize and know where they are. You can switch between clock numbers and words and colors and symbols in the same bout of exercise. So you're actively thinking while you're doing this. If you are particularly fit, you can jump with both feet from the center to this spot and back, or you can split and do 2 numbers at the same time. You can have 1 foot on one number and the other foot on the other number, so you're straddling and then you're coming back to center. So you can make this activity quite difficult. Oh, this is the something I was going to talk about, the Frax Plus. You can calculate your risk of 10-year fracture based on your age, your ethnicity, whether you have rheumatoid arthritis, whether you smoke, how much you drink, all that. And then if you have a DEXA scan results, like a T-score, you can put that in there and get a really accurate estimate of hip fracture risk. Okay, so clock yourself. Let's do this one. So this is really basic level with a physical therapist. They're actively holding on to you, but ideally you want to work away from that. This is you doing it at home. You're holding on. Ideally you want to work away from that. But this can, if you can't do single limb stance, that's a good way to start. Right? This is actual physical activity. So this is all clock yourself. Okay. And again, it gives you auditory prompts, so you don't have to look at your phone. And then what can you do without any of this? I don't want to sweat. I don't want to get up from my chair. I don't want to see a physical therapist, but I don't want to fall. So you can modify your home. This is kind of excessive. We had some OTs in the room. They're great at this. They're much better than physical therapists at modifying your home to prevent falls. But these are all grab bars in the shower. This person has way too many, but you get the general idea, right? You also want to keep your home really well lit, because what do we rely on for balance over 65? Vision. And what do a lot of people do at home? They have the blinds drawn and like one light on in the corner, which isn't good. You need to be able to see. We have a handout, I believe, on home modifications. Make sure that your shoes are really good. They're good for you. So if that means that they're relatively flat, then they're flat. If they have some cushion, then they have some cushion. If you have diabetes, you're wearing your diabetic footwear. You're getting your vision checked, and you're actually having someone look at your feet. Do you have sores? Do you have bunions? Do you need special shoes? Do you have ingrown toenails? Right? Get those checked out. And then you're going to your doctor and you're looking over your medication at least once a year. If your kidney function starts to drop or your liver function starts to drop, your medications may be too strong for you. Maybe. So take a look at that with your doctor. There are certain medications that people over 65 should not be on if they don't have to. It's called the De Beers list. You can go over it with your doctor. So if there are safe alternatives, get off those medications. And then please stay active. Even if you don't hit your 150 minutes, even if your heart rate is in zone 1, great, you're doing something. If you're already active, stay active. So if your hip starts to bother you, go see someone about it before you stop playing pickleball, right? And I think that's it. Oh, no, sorry. Someone mentioned silver sneakers, and so that is a good option as well. But these are evidence-based programs that are shown to reduce fall risk. They meet the 52-week requirement, and many of them are free. This one, there's one, let's see, it's at Pearl City Community Church, and Kaimuki YMCA has one going. There are multiple that are coming soon. Windward YMCA, Waianae YMCA, West Oahu, and Leeward YMCAs. I don't know in what stage they are. You have to sign up in advance because they approve you, and then they do a pre-test. And then you have to commit to going 3 times a week for 60 minutes. So you meet that 150 minutes. And they work on your cardio, they work on your balance, and they work on your strength. And they are set programs. It's not instructor varied. The instructor does the same thing with everybody. So that's why they've been shown by the research to be evidence-based, to decrease your fall risk. And you can start in a chair. I went to one at Pearl City Community Church. The instructor was lovely. She was over 65. She did a great job. People were really friendly. And I believe they're free. This is another one, Tai Chi for arthritis and fall prevention. I know some of the YMCAs offer it. Again, I don't know if it's free because you have to have a membership to the YMCA, but it has been shown to increase your balance, improve your balance, and decrease your fall risk. And again, it meets that 52-hour requirement, sorry. And then this is another program that was developed in New Zealand for people who maybe can't leave their homes, but want they used to be able to, and they want to get back there. And so they need really basic activity. It's monitored by a physical therapist, and the goal is for you to be able to do a 30-minute walking program at the end. So it's kind of a bridge. This is something that we were told to use for people who are leaving the hospital or leaving, they're transitioning out of home health, and we want to get them to programs like this, but they're not safe yet. So this is a good program that you would use to get there. Again, I wouldn't recommend it to do it by yourself, but I can give you the brochures. It's all available for free. But it was developed in New Zealand, where the physical therapist comes to your house. They have national medicine, so a little different than here. And then, yeah, Silver Sneakers, they have Silver Sneakers Classic, Zumba Gold, and Senior Fitness. And if you juggle these classes, and they're at the Y, I believe, you can meet your 3 times a week requirement, right? And you're getting variety, different instructors, different movements, different people. So it's interesting. You're leaving your house. And I think that's it, yeah.
I want to thank Valerie. Thank you so much, Valerie. Good job. Thank you very much. Have a great day.